Hi, Karen from Proactive Pelvic Health Center. Today I wanted to chat with you about 5 different tips and tricks that can help you manage your urinary frequency and urgency. Tip number 1, the distraction technique. When you feel the sudden urge to go to the bathroom, your mind cannot help but focus on your bladder. Try using a distraction technique to take your mind away from focusing on your bladder. For example, use your fingertips and push into your thumbs. As you're doing this, focus on the mildly uncomfortable sensation that you're creating. Whether this eliminates your urge or gives you enough time to get to the bathroom without a bladder leakage, give it a try. Tip number 2, reducing bladder irritants. Many things that we consume in our diet may be contributing to irritating the lining of your bladder. These can include caffeine, alcohol, carbonated drinks. So give it a try, reduce those or eliminate them and see how it goes. Tip number 3, increasing your water intake. It may seem counterintuitive to increase your water intake when you're experiencing urinary frequency or urgency, but that's not the case. Your bladder is housing the toxins from your body that your body is trying to get rid of. If you're not drinking enough water, these toxins will create too high of a level of concentration within the bladder, therefore irritating the lining. So try to get in the recommended daily intake of water and see where that takes you. Tip number 4, reducing stress. Your bladder symptoms may be correlated with the level of stress or anxiety that you're feeling. Try to engage in activities that can reduce or manage your stress levels, including breathing exercises, meditation, and physical activity. Tip number 5, the Bladder Diary. If you're not sure whether you're peeing too much, too little, if you're drinking enough water, or if you're having urinary frequency or incontinence, you may be able to log that down with a Bladder Diary. This can help you keep track of how often you're going to the bathroom, if you're having leakage, and how much water you're consuming. Bonus tip, if you're not sure where to get started, seek out help from a pelvic floor physiotherapist.